In the past few months, as Americans have retreated indoors, emergency emotional distress and therapy hotlines have been inundated with calls for help. According to recent polls, almost half of all Americans feel the coronavirus is harming their mental health, which we just discussed. Social isolation and fear of the virus are sparking a mental health crisis, one that we are ill-prepared to handle. Daniel Gillison is the CEO of the nation's Alliance on Mental Illness and joins us now. Daniel, thanks very much. This has been something I've talked to Mayor Francis Suarez in Miami, Jenny Durkin in Seattle, governors around the country, and they said this is the topic that no one's talking about that we really need to. So give us the dashboard that we need to understand, those people viewing today, on what's happening in the era of COVID on the mental health front in this country.
Well, first of all, thank you very much for the opportunity, Steve. And on behalf of NAMI, looking at that dashboard, we've seen a tremendous increase in calls to our helpline, the NAMI helpline, where people are stressed, feeling anxious, and dealing with quite a bit of anxiety. But as we look at this, there's cracks in terms of what we're seeing in mental health. And prior to COVID, only 43% of people with mental illness received treatment. So that was in 2018. So we already had that in terms of the outreach. And we had a tremendous demand and already a challenged supply. So now with COVID, and all of the social complications that have come with COVID, and the trauma and the anxiety has increased. As we look at our counties, 60% of our counties across the country don't have a psychiatrist. That was before COVID. So the demand is going to increase. We're already seeing it increase, and the supply of resources is challenged. So that is something that is very critical to us. And we also see the lack of diversity in terms of medical professionals. So that's also another challenge that's right there in front of us. And we need to be having that discussion. So thank you for the opportunity.
Well, let me just go a step further. Before COVID crisis happened, I did some interviews on mental health resources and support around the country. Interviewed Senator Roy Blunt, Senator Debbie Stabenow, who were responsible for helping to seed it. And they said, look, we've just got our toe in the door with some resources going out, particularly on the maternal care front. But there's so much more that needs to happen. Then COVID struck. Is there anyone really moving the needle right now on providing a lot more funding and support into centers around the country?
There is movement on the Hill in terms of seeing that there is a critical need that needs to be addressed. With the CARES Act, there was money that was allocated for mental health, not nearly enough. And then with the second package, we are advocating for additional money, $38.5 billion, and we're looking to even increase that by another 10, and looking at 48.5 to really address mental illness. A very small percentage of the money that was allocated in the CARES Act went to mental health. So we do see there being voices, conversations, and advocacy on the Hill. We need to see more of it, and we need to see more of it executed in actual funding and results.
Daniel, the storm of the day right now in Washington, which we've been discussing a little bit here and there, is the demand, really, from the President of the United States to reopen schools, come hell or high water, basically, to get back, get things back in the system. And just in the, completely anecdotal survey calling around the country, looking at it, a lot of parents are concerned and scared. Some parents do want to send their kids back to school and get back to normal, but a lot of parents are concerned. Are you anticipating an even higher rate of mental health stress over that issue of what to do with kids?
Yes. Not only are we concerned about it, we're seeing it in our own workforce. We have in our employ several parents who have school-age children, and they're very, very dedicated to the work at NAMI. They're very, very dedicated to making a difference in mental illness. And their challenge is toggling between being an outstanding parent and being an outstanding contributor to the needs that we have in mental illness. And these are dedicated professionals, and they're toggling both. They're concerned about the health and safety and the academic development of their children. And they're also concerned about how can they be successful at work as they're toggling the child or the children being at home, and do they risk their children being at school? I'm also married to an educator who has spent 30 years in educating sixth graders and has done some incredible work. So as this year has transitioned for them from being in person to actually doing it over technology, it's been a challenge there as well. But we see this polarity and the stress and the trauma that it's creating, both in our young people as well as in the parents.
Dan, we are taking questions today, and we've got one for you. Why don't we, I think we've got Amanda online. Amanda?
Hi, my name is Amanda Woodward, and I am a psychiatric nurse with experience in the emergency room, jail and prison settings, and also inpatient psychiatry. My question is this. There have been reports of some psychiatric units closing in New York and elsewhere during this pandemic. How is this acceptable given the long history of underfunding community and inpatient mental health care? How could we allow previously incomplete, spotty treatment options to become even more scarce? When will the discrimination against the mentally ill finally be resolved, including the IMD exclusion?
Great question. Daniel?
Thank you. We want to see that IMD exclusion changed. We also are very concerned about the number of psychiatric beds that are being decreased, as well as the facilities. So we're working across multiple organizations to address that, and we see it as a part of the problem. And we really do want to raise the visibility of it. And this is the worst time. If there is any time that it could happen, this is the worst time to see it occurring. We need to be making more investment in services and resources versus shutting them down. We're very concerned about exactly what you spoke about, and we are advocating for that to change and advocating for that in policy and in decision making on the Hill.
Well, Daniel Gillison, Chief Executive Officer of the National Association on Mental Illness, I really appreciate it. I support so much of what you do. Thank you for that. And I just hope people go to NAMI's website and look at resources there dealing with suicide, mental illness, all those issues out there. So, Daniel, thank you so much for joining us.
Thank you very much for the time, Steve.